بسم الله الرحمن الرحيم. احنا النهارده vertebral artery test. كل الحاجات دي خاصة بتاعة السيرفايكال سباين. assist الانتجريتي بتاعة الفرتبرو فاسكولار symptoms. البيشنت بيبقى نايم كده اهو، وانا بعمل passively take the patient head and neck into extension and side flexion. After this movement is achieved, the examiner rotates the patient neck to the same side and holds it for approximately 30 seconds. A positive test provides referring symptoms if opposite artery is affected. ده اسمه vertebral artery test. بيشوف الانتجريتي بتاع vertebral vascular system. أما يكون البيشنت supine, the examiner passively takes the patient head and the neck into extension and side flexion. After this movement is achieved، يعني هو اهو بيشد رقبته للناحية التانية. لو الناحية التانية، الناحية ديت لو فيها ألم اللي هي الأوبزيت سايد، يبقى الارتري الناحية التانية هو الكرومايزد. بعد كده في بقى تيست تاني. هاتوا انت تيست differentiated dizziness or vertigo caused by articular problem that caused by vascular problem. Patient sits and forward flex both arms to 90. The eyes are then closed. The examiner watches for any loss of arm position. If the arm moves, the cause is non-vascular. لو الارم moves يبقى الcause non-vascular. The patient is then asked to rotate and extend and rotate the neck. The position is held while the eyes are again closed. If waving the arm occurs, the dysfunction is caused by vascular environment to the brain. Each position should be held for 10-30 seconds. بعد كده transverse ligament stress test. بشوف الانتجريتي بتاع transverse ligament. Patient lies supine with head supported on the table. Glide C1 anterior should firm in the field. The position is held for 10-20 seconds to see whether the symptoms occur, indicating a positive test. Positive symptoms include soft in the field, muscle spasm, dizziness and nausea, paresthesia of the hip, face, limb, nystagmus, lump sensation is in the throat. Transverse ligament stress، ان هو بيرقد المريض على البلانس، وبشوف الانتجريتي بتاع الترانسفير ليجامنت وينعمه صباين والهيد سبورتد على التيبل، وبعدين جلايد C1 anterior 10-20 seconds. لو symptoms بدأت تظهر indicating a positive test. Positive test includes soft in the field, muscle spasm, dizziness, nausea, paresthesia of the lip, face and limb, nystagmus, lump sensation. بعد كده anterior shear test. Anterior shear test supporting ligament and the capsule tissue in the cervical spine. The patient lies supine with the head in the neutral, resting the hip. The examiner applies an anterior directed force through the posterior arch of the C1 or spinous process of C2 T1 bilaterally through the lamina of each vertebral body. In each case, the normal end field is tissue stretch with abrupt stop. A positive sign, especially when the upper cervical spine is tested, include nystagmus, pupil changes, dizziness and soft end field, nausea, facial or lip paresthesia and lump sensation in the throat. Anterior shear test. شوف الانتجريتي بتاع supporting ligament and capsule tissue the cervical spine. بيشوف الكبسولار تيشو وبيرقدوا على البلينس resting on the bed. بيعمل anterior direction force للposterior arch of the C1 spinal process of C2 ل T1 bilaterally through lamina of each vertebral body. Normal end field tissue to stretch an abrupt stop. Positive sign, especially when the upper cervical spine is tested. Nystagmus, pupil changes, dizziness or soft end nausea, facial or lip paralysis, lumbar sensation in the soul.